we go. Hey, everyone. It's 1 o'clock Eastern Standard Time, and here we are talking about eye problems and the remedies that help with that. Dr. Alex and I are here to share some wisdom around remedies, and I would like to introduce my partner, Dr. Alex.
Hi, everyone. I hope you will enjoy this chat today. We are going to talk not about all the eye remedies, but just a few commonly used. And we have as well a nice presentation for you. So we can start.
Great. Thank you. So let me see if I can get this to share the screen. All right, so we wanted to start with Aconite.
Yes. Do you want to talk about it, or do you want me to talk about
it? Sure, I'll talk about it for just a second, and then you can jump in and share what you know. Aconite is such a fantastic remedy. There's so many uses for it, especially when something happens very quickly. But when it's an eye injury, you can see the photo of the horse here with the weeping. There's redness, the eye is inflamed. It can be very deep red, especially in the vessels, and intolerable pain. So they're not going to want you to touch it necessarily. And profuse lacrimation, so a lot of tears. Swelling of the eyes, excessive photophobia. They don't want to be in the light. You'll find them kind of going to the back of the barn or hiding in a place or putting their head down so that it's not being further irritated, and you'll see a dilation of pupils. Dr. Alex, talk a little bit about the mind piece of Aconite. I know there's a lot of fear with this.
Yeah, well, there is a lot of restlessness, and they are very fearful, but it's a frenzy, it's a panic state. So they, in human terms, it's the person or the patient thinks that is about to die, and the same happens with animals. Of course, they cannot convey that, but you will see the way they act, and if a horse is in an aconite state, you will not be able to go near. What you can do, as we already mentioned before, is to use a spray with the remedy and try to spray it in the air, because as long as the remedy diluted is in touch with the mucosa, it can be of the eyes, it can be of the nose, it can be any mucosa of the body, it will start acting. Important to notice, out of all the symptoms that we are talking here, redness and swelling and pain, it will be almost a constant for eye injuries or eye infections, being conjunctivitis or even eye allergies. What is important to differentiate amongst other remedies, when you see profuse lacrimation, there are 3 remedies that should come to your mind immediately. One is Aconite, the other is Euphrasia, and the other is Allium cepa. Allium cepa is more indicated in case of allergic reactions.
Right.
Euphrasia can apply in allergic reactions as well, but the way to distinguish between Euphrasia and Aconite is that Euphrasia, and from Allium cepa as well, is that Euphrasia, the lacrimation will be very acrid. So the lower lid will be probably more swollen or more red, and if it is on a child, for instance, that doesn't have hair, you will see excoriation, you will see redness of the cheek as well.
So it's almost, you said lacrimation, but it was acrid. So it's almost acidic or burning,
Yeah,
right?
exactly.
There's that burning sensation.
Yeah.
Okay. Okay.
So profuse lacrimation, 3 remedies: Aconite, Euphrasia, Allium cepa, but Euphrasia will be acrid lacrimation, so acrid tears, and Allium cepa will be bland but more allergic. Aconite, it will be sudden
Yes.
circumstances, either injury or an infection that the horse was okay now, and in 3-4 hours is the eye, is
It comes
really
on suddenly.
Yeah.
The time that I've seen this with horses the most is when they're being loaded and unloaded from trailers. They often bang their eye when they're coming out, if they're really stressful, if they're very highly anxious animals. If you're trailering a horse and you know they're anxious, if you can, get a dose of aconite into them before you try and put them on the trailer. That tends to make a really big difference, and you see a lot less injuries that way.
so true. And don't give it before 5 minutes, give it before
An hour.
2 hours
Yeah.
to let the remedy act.
Yeah. It allows their whole system to just calm down.
Yeah.
So
absolutely.
the next remedy that we're going to look at is, well, really, Aconite and Arnica are like the 2 top that you should always have in your back pocket. So we were going to talk about Arnica, and we all know that it's one of the first remedies we tell almost everybody to reach for when there's been some kind of injury. So talk a little bit about this, Dr. Alex, with regard to the eye specifically, because there are other remedies that act like Arnica when it comes to the eye, but Arnica has some very specifics.
Yes, so Arnica is contusion. Think about Arnica when there is a blunt impact or contusion. And Arnica will deal with the shock not only on the eye, but emotionally as well, that happens when somebody gets injured. And of course, because it's a blunt contusion impact, the eye will be swollen. There can be a bit of hemorrhage underneath. The difference between Arnica and Aconite is in Aconite, usually the pupils are dilated. In Arnica, the pupil will be contracted, and the animal might be, just don't touch me.
Yeah, that's kind of the general attitude, right?
Yeah.
I don't need your help.
Yeah, I'm fine.
Go away. I'm fine. I don't need your help. Yeah.
So you witness that there was a big impact, but the animal might be acting like nothing happened. I'm okay. I'm perfectly okay.
Yeah. And I've read and I've seen this to be the case with Arnica, that it's really good for injuries in the orbit of the eye. With a black eye, you think of Ledum. That's what always comes to mind for me. But they talk about the injury to the actual orbit around the eye with Arnica as well.
The eye socket. Well,
Yes.
I actually prefer Symphytum than Arnica.
For the eye socket, yeah.
For the eye socket. And we're going to talk about Symphytum.
Yes.
It's absolutely recommended to give Arnica and then follow with Symphytum.
With Symphytum, yeah. Those are kind of like the first 2 with an eye injury to start with.
And they complement each other, so it's good. Don't give them together. No. No
matter how much you want to. And even if if you have to, you can space them up to 30 minutes apart, but we really encourage to allow one remedy to take action, to do what it is that it's good at. So Arnica is such a good place to start it. It really does calm the system down from the overall trauma. And then you often get a better picture of what the symptoms are when the animal or the person is in a better state, when they're not in the state of trauma. So it can be really, really helpful in that respect. The next remedy we have is one of our personal favorites. It comes up a lot for us, and it's Belladonna.
So with Belladonna, the eye needs to be very red. Belladonna is all about congestion, is all about redness. Like Aconite, the pupil can be dilated, or the eye will have a bit of a glazed look on it. And so, yes, with redness, extreme redness of the eye, think about Belladonna and Euphrasia. Euphrasia will have tearing, Belladonna will be dry. And there will not be any tearing, any secretions, anything like that. And of course, if the whole animal is also in a total Belladonna state mentally, because now we are talking about acute situations mainly. Sometimes the local part might express the remedy that needs in the acute, but not necessarily be on the mental and emotional state.
Right, the whole picture.
Yeah. If
I
it
find
is in a state, it will have fever and they will be delirious. So,
Yeah.
you know, in a wild kind of state.
I find with Belladonna, I always find it fascinating because the berries of Belladonna are so dark black, but it seems like almost all of the symptoms, regardless of the body part, that gives you the indication that Belladonna is indicated, everything is red, whether they have a red face or a red eye or a red part, and there's often heat. You may find that if they've injured their eye, and it's just their eye that they've injured, that all of a sudden they spike a fever, and it happens very quickly. Things with Belladonna tend to happen very fast. And then the Materia Medica talks about the spasms and the convulsive movements of the eyes. And that's a really good indication for Belladonna too, especially if it comes on very quickly. The thing that surprised me was the eyelids wide open. And I have seen that Belladonna state where they're glazed over. They don't look like they're present, but their eyes are wide open, which is like, it's just a fascinating piece as far as the symptom goes. So the next remedy is another favorite, and you'll see us talk about this a lot on the page for a variety of different reasons, and it's Calendula. This is just one of the most amazing flowers. It's so healing on so many levels. The infected wounds, inflammation with pus following injury, after operation, having that excessive discharge of watery mucus, and having the option of using it herbally, topically, or as a remedy internally. And I've used the remedy topically as well, where I've put it in water. If it was a high potency, if I knew I was only going to get to the animal one time, and it was something to this degree where this goose is clearly, had quite a bit of trauma and an infected wound in its eye, and having 11 geese, I've definitely been down this road before, and just soaking something like a paper towel or a clean cloth in the water with the remedy in it and applying it has really helped. If I'm not able to, if I don't have the tincture handy, or I don't have an ointment or a drop that I can make, just using the remedy in water can make a big difference. And then putting it in their water, because geese will drink and they kind of dunk their whole head. So that's to your advantage when you're treating waterfowl. If you can give them a container big enough to shove their whole head in, that's a great way. That's a really great way. And obviously you don't want them to do it over and over and over and over again, but it is a really wonderful way to treat waterfowl.
Yeah.
Tell us your thoughts on calendula.
Well, you covered it all. I would just say, if you use tincture topically, fantastic. Tincture is, I think, every single household should have a big bottle of calendula tincture because they have so many uses. But the ice, please remember to dilute, because
Yes,
that is alcohol based and you don't want to put that pure in an eye. You can put it in the ear, which is perfect.
yeah.
But yeah.
Not in the eye. Yeah, no, you won't get a good response from that at all. But it is a fantastic thing to have. Calendula and hypericum or St. John's wort are two of those tinctures that I feel like I agree everybody should have in the house. So the next remedy we're going to talk about is Euphrasia. And a lot of people reach for this. It's eye bright, which is the herb. It's such a beautiful flower. And I've used this many times. You'll find it in a lot of homeopathic eye drops in many formulas and combinations. And I do try to keep those in the house as well, because it's easy to reach for as opposed to having to make something when you're in a trauma situation. So you were talking about the differences between Euphrasia and which remedy was that?
Well, Euphrasia and Aconite when it comes to tearing, and Euphrasia and Belladonna when it comes to the redness. But the way to distinguish from the other remedies is that in Euphrasia, and this is a perfect eye of Euphrasia, it's in a dog, but it can be anywhere, in any animal or any person. You have redness, you might have lacrimation, but on an animal, because they are hairy underneath, you cannot really see. But what you will notice is that there will be a slight swelling of the lower lid. Because even if there is not profuse lacrimation, the tears are so acrid that will make the lower lid slightly swollen. And you notice here on the picture of the eye of the dog that the lower lid is swollen.
Yeah, and you know, again, it's one of those remedies that you think of. Symphytum and Euphrasia are two of the remedies that I think of when you see irritation, but there hasn't necessarily been an impact or a blow or a blunt trauma kind of thing, because it's very soothing to the eye. That's what I've found, especially when treating the birds, which is what I've had the most experience with. That and the cats, they're harder to treat. So the next remedy that we have today is Ledum, which is all about blunt trauma and puncture.
Well, I just forgot to mention
about Euphrasia.
No, about the slides that Rebecca did. I didn't.
You did too. You were totally part of these.
The artistic part is all yours. I just want to make to elucidate the members that all the pictures, the lower pictures of the plants that you see underneath are the actual remedy. So here in Ledum, the flower and the plant you see underneath is
the actual Ledum plant.
Yeah, exactly. It's Ledum palustre, the plant from where we make the homeopathic, well, not we, but the pharmacists make the homeopathic remedy. And the same was with Euphrasia, the same was with Belladonna, with Aconite. So I just...
Yeah, we're noticing a trend here. They're mostly plants.
Yeah, actually true. So Ledum, it's bruised eyes, but it's not the eye socket. It's actually the eyeball that is injured. And so for me, is the arnica of the eye. Of course, the eye will have a bruised appearance, and it can be also bloodshot if there is some hemorrhage in the eyeball. The tears can be a little bit acrid, like Euphrasia, making the bottom the lower lid, the bottom lid, a little bit more swollen. And you can have slight discharge and agglutination of the eye, but not much actually. Usually, if we are talking about big discharge, we are thinking about pulsatilla, calc sulf, borax, arginate. So there might be a little bit of discharge, but not that much. But this poor dog shows exactly a Ledum eye, and the impact was so big that he has a big scar on
his face too. Yeah.
Face too. So there was really a massive impact over there.
And I imagine, it's tough with animals. You don't see the bruising, because unless with this dog, you might, because of the really fine color with the white hair. But with a lot of animals, you just don't. And sometimes their skin is really dark too. So, it might be a physical exam that you need to do to see what the response is with the eye. If, obviously not going to put your fingers in their eye, but around it to see if they're responding to the bruising. The difference between Ledum and Arnica is they don't mind being treated. Arnica doesn't want to be treated. They want to be left alone. But Ledum, they are more open to allowing you to actually give them a remedy or get the remedy into them, or give them some consolation, that sort of thing. They're not as clingy as pulsatilla, who's saying, oh, please take care of me. I can't live without you, but they will at least let you get close to them so that you can get a remedy into them.
And you can see here in the picture that it's not really, the bruising is not really around the eye. It comes from the eye itself.
Right.
And there is a bit of acrid discharge as well, coming down. You can see the redness of the lower lid more than the upper lid.
Yeah. So the next remedy is silica. I know. Somebody just posted, not on our group, but on a different group, about their dog getting a face full of porcupine quills. And when we were thinking of remedies last night, we'd come up with a list. And then this morning I went, oh, but wait, I've seen this happen so many times. And I've never understood why dogs do it more than once. That's the part that always surprises me. But with silica, it's all about expelling foreign objects. Obviously, you're not going to just give them silica and walk away. These all need to come out. But with the quills, they have barbs, and they have to be pulled out one by one. They say to take them to a vet. It's usually better if they anesthetize them. But with some animals, they might get 3 or 4 in them. Hopefully they're smarter than this dog was. I think he must have shoved his head in a hole or something and found the back end of a porcupine. But the barbs can leave bits in the puncture wound. So silica is a very good remedy about expelling things. One of the things that I often remind people about with silica is that it's not fast acting. It's not like Arnica. It's not instant. It does take time to actually move things out, whether it's a splinter or a barb or what have you. But the inflammation, the ulcers on the cornea, the pustules on the lids, you'll see lashes falling out if they need silica, which is kind of interesting because you wouldn't think of giving them silica when stuff is falling out already. And then pus on the margins of the lid with burning and stinging and redness. And going back to the photophobia, not wanting to be in the light, that it really, really hurts their eyes. Alex, what's been your experience with silica and eyes?
Not very nice. I treated a horse that had a porcupine. I don't know if he sniffed the porcupine or whatever happened on his nose.
Mm-hmm.
But it wasn't this disaster. It
No.
was fine, and after a few doses of silica and Ledum, he was fine, no problem whatsoever.
And
Silica, usually I never treated for injuries. I used many times silica, but it was inflammation, and usually we have glands associated with that, induration of glands. You will see glands in the neck or in the face, or lymphatic nodes, or
or some kind of abscess. Yeah, and certainly with something of this nature, not necessarily in the eye, but around the eye, on the face, they may have something enter, and when it's removed, everything doesn't come with it, and they may get an infection, and silica can actually help to clear that out. One of the interesting things I remember from way back in school was one of the things that my teacher always said was acupuncturists often need silica. And I thought that was fascinating. It's all about the needles. So that was something else that came to mind when I saw this picture today. I did many years ago have a German Shepherd that had a propensity for chasing bees and trying to eat them. And a bee stung him right in the eye, and apis really, it swelled, it was, terrible, et cetera, and so on. But the stinger got stuck in the dog's eye, and it was silica that actually got it out. So if you have one of those dogs that's crazy and goes after a bee more than once after being stung, silica is something that you might want to think about if you feel like the stinger is stuck in them.
It's common, my dog chases flies and mosquitoes and anything that flies around her, and the other dog was a complete chaser of bees and hornets and wasps, and would eat them as well. So I think it's quite common with dogs.
Yeah, for dogs and cats too, but I've never seen a cat get stung in the face by something that they've been chasing, so that's a good thing. So Symphytum, we were talking about earlier, it's one of the number ones. You start with Arnica and move to Symphytum when you see an injury from a blunt instrument, a blow, a knock. Sometimes they're coming around a corner too fast. Or if they're in a herd, they might get shoved into something and get, their eye smacked. I think about cattle when they're out in pens, and because they're kind of at that same level as, especially the metal fencing that they put up and, manipulate to make corrals. And same thing with pigs and sheep, anything that gets corralled and pushed into an area, their faces are kind of at that level where they can get blunt trauma. The pain in the eye after the blow, and the eyelid kind of slams shut, and even if you try and open it, it slams shut again. And I've seen that with birds too. So Alex, what were the differences you had talked about between the Symphytum and Euphrasia? I think it was those two. Ledum. Okay.
So Ledum, it's more the injury of the eyeball. So it's bruising of the eyeball, while Symphytum is about the socket. And I've seen it many times with balls. you know, especially with kids playing football or tennis balls, when somebody smacks the ball and just by chance hits the other in the face, right in the eye. And the ball catches the socket, and all this area gets bruised. So, and it makes sense because Symphytum is the knitting bone, and it has a huge affinity to the bones, and the eye socket is bone. So if there is a lot of bruising all around the eye in the socket, I would go for Symphytum. Out. And of course, the swelling is going to be huge, and then everything is going to come down, and the blackness will extend as it heals. But
yes. And the final remedy that we wanted to talk about, this is actually my rooster. And 2 years ago, we had 2 roosters, and the other rooster was not nearly as nice as this rooster is. This guy is, I think he's an Americana Brahma mix. He's enormous. He's a great big boy. And this other rooster just kind of had it out for him. And we try and keep them apart. And this actually happened in between a fence. So one of them was on one side, one of them was on the other. Needless to say, the next day, everybody got hardware cloth on the bottom, so it couldn't happen anymore. But so the upper left photo is, I think, and I don't have all the pictures for whatever reason, I wasn't able to access them, but it is 2 years ago. And that was probably a month or so after it had happened, maybe a little bit longer, because I know it happened in the summer. When it originally occurred, his eye swelled up, slammed shut, and I started him. I did the Arnica, then I did the Symphytum, and things didn't get any better. And it got really pussy. And I thought, he's going to die of an infection. And so we started on the Calendula for the infection in his body. And I remember trying the Ledum, and there were a couple of other remedies in there. It was like, how many different ways can we come at this? And there were days where it would just be swollen and shut, but there were other days that it was in really, really rough shape. And so I was talking with another homeopath friend of mine, and she said, "Oh, look at Rhus Talks." And I went, "Rhus Talks for an eye? Never heard of it. Never, ever hit my radar." And she said, "Yeah, it's for old eye injuries." And I was like, "Okay, I'll give it a shot. I've got nothing to lose." And within a week, all the pus was gone. His eye had returned to a normal size, and he wasn't favoring it anymore. I mean, he was really hurting when it was all swollen and full of pus and oozing. And he didn't really want to come out of the enclosure and go outside because the light really hurt as well. So again, the photophobia, the profuse flow of yellow pus, the edema of the lids, and an old eye injury. And so this is him. I literally took this morning in the upper right and the lower picture. And he's the only rooster now. We ended up losing that other rooster, and I don't think anybody misses him, though he was great fun to watch. He had quite a personality. But our boy, who's, I want to say he's 4 now, he's doing great. He's amazing with the hens. He's so good at protecting them. He knows that he's only got one good eye, and he keeps it on them at all times. And I had done a workup at the time when she said Rhus Talks, and I wanted to share that with everybody as well, just to give you an idea of what the rubrics look like and how many rubrics showed up for this case. So eye abscesses, suppurations, lids, cornea, the profuse discharge, purulent, thick, yellow, the inflammation, after injuries. That's the old injury piece. The other one is eyes injury after. We couldn't find old injuries in eyes, but this was the one that that we both felt was representing that particular piece of the remedy. So it's one more thing to put in our toolbox for eyes is Rhus talks. And I believe everybody saw the post, or several of you saw the post about my gosling. And I'll see if I can jump over to Facebook. Maybe, maybe not. And I had a gosling who we had to bring inside for a period of time because mom and dad had been a little too, not aggressive, but they were a little too clumsy, I think is a good way to describe it. And they were stumbling over the goslings. And so I brought her inside and we started to put her outside in a pen every day so that she could still socialize with everybody because she was all alone. And I wanted her to still have that relationship with the parents and aunts and uncles and so on and so forth as she was developing. But I needed her to get big enough, 3 to 4 weeks, they say, before you can put them back with the flock so that they don't get stepped on. And I think she smacked her eye on one of the rungs of the pen that I had set up. And I went out to get her after a few hours and I found her eye was all swollen and it was teary and it had some goop in the corner and you know, it looked quite agitated. So I gave her some Arnica. Actually, no, that's not true. I think I started her on Ledum because I wasn't sure if she had gotten stabbed or just what. And then after a day of Ledum, we moved over to Euphrasia. And the acrid discharge, the burning and swelling of the lids and the frequent inclination to blink. She was constantly blinking. And then by day 4 or 5, she was all healed up again. So it's really something when you have a tool this effective that you can pull out and not have to go rushing to the vet or, you know, have to segregate them and put them in a dark box or what have you. And to see the healing happen so quickly. She wasn't super excited about the fact that I used to put her in the bathroom sink and I'd put enough water in there so she was buoyant, you know, so she was floating around. And then I could actually swing her so I could dip her head and put drops in. But her eye is all better. So it's a good thing. She was born late May, so she's pretty much full size now, and you wouldn't know that anything had happened to her eye. So it's great. So any other wisdom around eyes that you want to share before we sign off for the day? We want to thank everybody for watching and connecting and asking questions. And one of these days, we're going to figure out how to get people in here with us. That's something that we want to do next too.
No, not really. I think we talked about pretty much everything.
We covered it all.
Well, all definitely not.
We covered a lot. We usually do.
Yeah.
So thanks everybody for watching. And if there's a remedy that you do want some more information about, please reach out, post a question, share your stories. And let's see, I'm just trying to get back to this real quick. And if you have an issue where your animal has been injured, you need some support, you're looking for some help with the remedies, something's not working, or you would like to connect with us about the whole farm, because we do offer farm support. We offer monthly farm support. We've actually done that for a couple of farms. And it's really fun for us too, because we get to work on a bunch of different animals. This is our contact information. We are Homeopathy United, and we are the admins of the farm animal and homeopathy page, and we look forward to connecting with you soon. So thanks, everybody.
Bye-bye.
Bye.